Assalamualaikum warahmatullahi wabarakatuh. First, I give thanks and gratitude to the presence of God because of His grace and guidance. I'm still given heart and can speak here. Previously, I would like to thank you for being given the opportunity to deliver my speech about COVID-19, which is rife throughout the world. Coronavirus disease 2019 or COVID-19 is an infection disease caused by SARS-CoV-2, a type of coronavirus. This disease resulted in 2019 to 2020 coronavirus pandemic. Patients with COVID-19 can experience a fever, dry cough, and difficulty breathing. Sore throats, colds or sneezing are less common. In the most vulnerable sufferers, this disease can lead to pneumonia and multi-organ failure. Infection spreads from one person to another through places of the respiratory tract that often result when coughing or sneezing. The time from viral exposure to clinical symptoms ranges from 1 to 14 days with an average of 5 days. The standard method of diagnosis is to back transcription polymerase chain reaction test from nasopharyngeal swabs or sputum samples with result within a few hours to days. Antibody tests from blood serum samples can also be used with result within a few days. Infections can also be diagnosed from a combination symptoms, risk factors, and compute tomographic scans of the chest that show symptoms of pneumonia. Washing hands, keeping a distance from people who cook, and not touching the face with unclean hands are the recommended steps to prevent this disease. It is recommended to cover the nose and mouth with a tissue or elbow that is flexed when coughing. The World Health Organization and the United States Centers for Disease Control and Prevention recommended those who suspect that they have been infected to wear surgical masks and seek medical advice by calling a doctor and not directly visiting the clinic. Masks are also recommended for those who treat someone who is suspect of being infected but not for general public use. There is no vaccine or antiviral drug specifically for COVID-19. The procedures given include treatment of symptoms, supportive care, and experimental measures. In Indonesia alone, the number of people who are positive about this disease has reached 3,009 people, 15 recovered, 25 people die from this disease. Therefore, I urge the Indonesian people to remain at home so that the spread of the virus is not widespread, unless there is an urgent need. And don't forget to wash your hands when you have gone outside and never hold your face if your hands have not been washed. That's all the speech from me. More or less apologize. Wassalamualaikum warahmatullahi wabarakatuh.